Hello, my name is Nurse Pauline RN. Welcome to my channel. I will be uploading videos on Tuesdays and Thursdays at 2 p.m. Eastern Standard Time. The title of my video today is Promoting Wellness, Health, Illness, and that's taken from Chapter 3 of your Fundamentals of Nursing. I have had 16 years experience in the hospital. I worked on the medical floor, a med-surg floor, a tele floor, cardiac unit. I've worked in the emergency department and the ICU. In this video, we will be presenting only answers. Someone had some concerns, but I do not do question, guys. No multiple choice for me. When you come to my channel, it's just to decrease your stress, just for you to relax and just channel into your answers only. I'd like you to hit the like button that's on your left just below this video, and if you'd like me to continue bringing you answers, please hit your red button on the right just below this video and share this video. Along with this, I would advise you to do your test taking skills, and your nurse educators are doing a fantastic job. And I know you have 1,000 videos out there where you can practice your multiple choice. My first answer today for you. Number one, we have examples of healthcare services. That's primary, secondary, and tertiary care. Extended care providers, medical and non-medical care for people with chronic diseases and disabilities. These are people who are in your extended care services. That's in your nursing homes. Direct care is bathing your patients, dressing your patients, wound care, changing wound dressing, teaching patients, administering medications. These are all examples of direct patient care. In nursing home, patients need lengthy stay for physical therapy monitoring, medication assistance, and to assist them with activities of daily living. A nurse is supposed to be a critical thinker. Self-knowledge is being aware of your religion, culture, and value. Research process is assessment, diagnosis, planning, implementation, and evaluation of your patients. Nurse-sensitive indicators are outcomes that are sensitive to the nursing process. CHAP stands for Community Health Accreditation Program. It's a non-profit organization. Managed care provider receives a predetermined capital payment for each patient costs. That's your managed care. Healthcare regulation and competition control healthcare costs. Healthcare delivery system focus is on integration of care, encourages greater patient involvement, and shifts from illness to wellness. Issues in healthcare are nursing shortages to deliver centered care. Direct care providers are roles of nurses. These are managers of the healthcare team, administrators, nurse practitioners, clinical nurse specialists, in-service educators, researchers. These are all your direct care providers. These are the roles of nurses. Your healthcare settings are hospitals, primary care centers, ambulatory care centers, clinics, healthcare services for hospice patients, healthcare agencies. These are all your healthcare settings. Outpatient services are less than 24 hours. Example, in and out surgery. Inpatients are for patients who are hospitalized for greater than 24 hours. Healthcare delivery systems focuses on integration of care, encourages greater patient involvement, and shift from illness to wellness. Healthcare regulation, competition created, professional standard review organizations. These are your DRG organizations. DRG stands for Drug Related Group. RUG stands for Resource Utilization Group. Also Medicare, also Managed Care. These are your healthcare review organizations. Please guys, hit your thumbs up on the left right below the video. Hit your red button to the right just below your video. Characteristics of continuously learning healthcare system is science, informatics, real-time access to knowledge. These are characteristics of continuously learning healthcare system. Healthcare delivery systems are coordination organizations. Your healthcare delivery systems are coordination organizations, and examples are community health care centers, accountable organizations, PPO providers. PPO stands for Preferred Providers Organizations, and your PPO providers are health maintenance organizations, multi-specialty groups. These are all your healthcare delivery systems. They are coordination organizations. State Nurse Practice Act regulates nursing practice in individual states. RUG stands for Resource Utilization Group, for Medicare reimbursement and long-term care facilities. That's your RUG, Resource Utilization Group for Medicare reimbursements. These are your long-term care. Collaborative care, our healthcare team working together. These are your physicians, your nursing assistants, your CNA, your dietitians, your spiritual care, chaplain, pastoral care, speech therapist, assist with swallow evaluation of your patients who are having difficulty swallowing. We have your occupational therapist, we have your respiratory therapist, and that seems to be what collaborative care are in the healthcare system. We have CHAP, C-H-A-P. CHAP is Community Health Accrediting Program. CHAP is Community Health Accrediting Program. And ANCC. ANCC stands for American Nursing Credentialing Center. ANCC stands for American Nursing Credentialing Center. A social worker is a person to which the nurse consults before patient is discharged home. We consult the social worker about financial and family stressors concerning the patient. We are going to make sure the patient has oxygen to go home with, medical devices to go home with, for example, bedside commodes. We have oxygen delivered to the patient's home, and that's about it. Some patients may have financial problems, paying for their prescription. This is something you would communicate to the social worker. There are 8 dimensions to a patient. There are 8 dimensions to a person. First is respect. Next is emotional. Next is communication. Next is patient involvement. Next is information. Next is transition of care. Next we have access to care. And the last one we have is centered care. These are all dimensions, 8 of them, of the patient. Managed care allows patients to choose providers, to choose physicians, medications, medical devices. Managed care is a preferred provider. Medicaid is given to patients without ability to pay for services, women and children. Medicaid is a low-income provider for medical cares. Medicare is for adults over 65 years old. OBRA, OBRA stands for Omnibus Budget Reconciliation Act regulates standards for long-term care documentation. OBRA, Omnibus Budget Reconciliation Act, regulates standards for long-term care documentation. A medical neighborhood is a patient-centered medical partnership, and other clinicians providing healthcare services to patients within it, along with the community and social organizations, as well as state and local public health agencies. A medical neighborhood is a patient-centered medical partnership and other clinicians providing healthcare services to patients within it, along with the community and social organizations, as well as state and local public health agencies. Guys, hit the thumbs up button. That's your like button on the left below this video. Hit your red button below this video. This allows me to notice you as soon as I upload a video. And you'll hit that red subscribe button if you'd like me to continue giving you all the answers you will need. You may not use these answers here in fundamentals exam, but once you go out into the workplace, guys, you are expected to know all these answers, because in the hospital we have what's called yearly competencies. We will have to do computerized multiple choices every year, and this starts from January all throughout until the end of June. It is mandatory, guys, that you answer all these questions. It seems like about 200 bearer of good tidings, but they are all multiple choices. You're gonna be expected on these in services that appears on your My Learning space in the hospitals to complete them. You're expected in some of them to get 100%. If you do not get 100% in these multiple choices, you will have to repeat. Some of them requires 80% passing. If you do not get that 80%, you will have to repeat, guys. Please start learning these answers from now, that you will make your life much easier in the workplace. You will be able to practice safely. You won't be able to ask in your charge nurse 1,000 questions when she has 6 patients. Learn all these answers now, that on the first day in the hospital you can hit the ground running. Thank you. Have a great weekend. Stay blessed. Bye.